Okay guys, we're going to get started on Chapter 8, Morbidity and Other Miscellaneous Rates. And if you take a look at the key terms, you're going to see all the different rates that Chapter 8 is going to discuss. Chapter 8 is the catch-all chapter, which means that if they couldn't find a chapter for it anywhere else in the textbook, it wound up here. So let's take a look at Chapter 8. Alright, so the first types of rates, well, they give you some definitions for morbidity, but the first types of rates that they begin to talk about are infection rates. They go over a couple of different infection rates. I don't know if you've been able to read through your chapter yet, but the first one that they're going to talk about is the hospital-acquired or nosocomial infection rate. So it's really important that you know this rate by the two names. They're synonymous terms, either nosocomial infection or hospital-acquired infection. Down at the bottom of page 146, a nosocomial or a hospital-acquired infection is the number of hospital-acquired infections in the hospital for a given period of time divided by the total number of discharges including deaths for the same period. So why do hospitals track nosocomial infection rates? They look at these infection rates because what they're judging and rating are the fact that their otherwise healthy patient that they screened coming into the hospital somehow acquired an infection through no fault of their own while in the hospital. And so if you take a clean patient, and the key to knowing that they're clean is that you've tested them on the way in, you know they're free from infection, but yet they develop an infection while they're in the facility, that can affect all kinds of things. It can affect reimbursement, it's going to affect their course of care, so it's just generally not a great thing for your patients to be developing these nosocomial infections. So page 147 has the actual formula. It's the total number of nosocomial infections over discharges including deaths for the same period, because you're going through the actual over potential, so the actual number of infections over the potential population. And so it makes sense to use discharges because potentially all of your patients could be discharged with an infection. So we've got 8.1. You know, this drives me nuts when the table starts on one page and finishes on another. I wrote down for 8.1 and then I was like, oh shoot, that's right, they have that. So I'm going to skip over to 8.2 to this next table of information. Using the information in the table below, calculate the rates requested. In this exercise, the deaths are included in the discharges and they ask you to round to 2 decimal places. So you've been given university hospital statistics by service, and that includes number of discharges, number of deaths, and then the number of nosocomial infections. So the first block asks for gross death rate for each service, and so if you want to pause the video here, if you've done the gross death rate, you can check your answers. So I'm going to let you pause, and you can come back. There's also the total gross death rate, and then really what we're going to spend most of our time on is the hospital acquired infection rate for each service. And so I've got the answers written there since you don't have the answers to the even numbered questions. Here's how you work the first one, the medicine service. So let's take a look at that. So if we're taking a look at our table of information, our formula told us that we need the total number of nosocomial infections multiplied by 100 over the total number of discharges. So I pulled the infections, the discharges. When you calculate it out, it's 2.11%. So then, what I have here, if you wanted to hit pause again, you could take a look at the rest of the answers for the services. And then the last block asks for the total hospital-acquired infection rate for the semi-annual period. So you had a total of 149 nosocomial infections, and you had 9,513 discharges for your overall semi-annual period infection rate of 1.57%. So what a hospital would do is they may track each one of these services individually, and they have a number that they're trying to hit or not hit. And then, of course, they're tracking this for Joint Commissions as well. These are reportable statistics to accrediting bodies, and the fact that you're tracking and then what your action plan would be if you ended up over your benchmark or your threshold or your trigger number, whatever you wanted to call it, so you could show progress on what you were going to do to reduce the number of hospital-acquired infections. The next type of infection rate that your textbook talks about is a post-operative infection rate. And so as it suggests, this is an infection that occurs specifically after surgery, post-operative. You've got two different definitions here of surgical operation and surgical procedure. You're going to need to know those for coding. So these came up in another chapter anyway, and I said, you know, if you want to impress Shannon, go ahead and learn these. Well, here they are again. So go ahead and know the difference between a procedure and an operation. You're going to be given that number most of the time in any situation where we are, but knowing the difference between a procedure and an operation so you don't pull the wrong number is paramount. That's why they go into this to describe what the two are. So while you're pulling numbers out of the table, you're actually reaching for the right one. So the rate actually asks you for the total number of infections in clean surgical cases. And if you pop above where the actual formula is, a general definition of a clean surgical case is one in which no infection existed prior to surgery. So again, it's like having a clean patient when they come in. You want a clean surgical case, meaning your patient has been tested prior to the surgery. You know they do not have any infections or not being treated for any infections, and so anything that is acquired post-operatively in the surgical wound would be pretty much deemed a post-operative infection rate at that, or post-operative infection at that point. So it's the number of infections in clean surgical cases, which you would be provided that number, over the total number of surgical operations for the period. So if we flip on over to 8.4, which is our first opportunity to work out the post-op infection rates, you'll see that using the information in the table below, calculate the rates requested, round to 2 decimal places. So you've got community hospital by month, 6 months. You've got live discharges, and then you've got your deaths broken down into post-op and other. Then you've got your infections broken down post-op, nosocomial, the number of patients operated on, and the number of surgical operations. So you see why it's important to follow the formula so you pull the right number. This one required a lot of math as well, so if you would like to pause here, I've got the numbers for you for 1 and 3. So I'll let you pause and write down those answers, and you can go back and check yourself. But after calculating everything, you'll see that March is the month with the lowest postoperative infection rate. And so we're setting that up, right? The number of post-op infections to the number of surgical operations. Number 2 says the post-operative infection rate for the semi-annual period. So you're going to add up all of the post-operative infections. You're going to come up with 19. And then to that, remember your formula says the total number of surgical operations for the period. You're going to come over here and add this column, and you're going to come up with 3818. You pop those into the formula. Total number of infections multiplied by 100 over surgical operations for 0.50%. Don't forget your leading zero. If you don't have that leading zero, somebody may miss the decimal and say, oh my God, that hospital has a 50% postoperative infection rate. Would you want to go get surgery there? I would not. So make sure you've got that leading zero so you don't drop that decimal. Number 3 deals with postoperative death, which I already had you pause and you could grab the answers. And then number 4 asks you to calculate the postoperative death rate as well, which was in a prior chapter, so I have this here. And also you can pause and grab the information for the gross death rate. Not forgetting that the gross death rate wants all of the discharges, which you have live discharges and then a breakdown of deaths. So that's what I have indicated here. All right, at the bottom of page 153, another miscellaneous rate is the complication rate. And so the definition of a complication is a medical condition that arises during an inpatient hospitalization. It's not planned. It's not part of the pathway of care. It's something that drives the patient off that plan of care when a complication arises. Could be, as you see here, that the hospital stay extends the length of stay by at least 1 day in 75% of the cases. And so, as with infections, complications increase the length of stay, therefore the rate of reimbursement is affected. Also the fact that now your patient has some kind of complication that is going to require additional medical treatment. So complications may be related to the quality of care received by patients, not always necessarily, but that may be one of the reasons why your patient has a complication. The purpose of collecting that complication rate is to determine if changes in treatment or practice in the facility can prevent them from occurring again. And we're going to talk about complications and care maps and care plans next spring in your quality management class. So we're going to tie this all back together. The bottom of page 153 does discuss what examples of complications could be if you weren't real sure exactly what a complication was. So make sure you read through that in case you've been given a listing of complications and you have to pick from a list. At the top of page 154, you do have a general formula for the complication rate, and it's total number of complications for the period multiplied by 100 over total number of discharges. And if you think about this in actual versus potential, it makes sense because each one of your discharges had an opportunity to have a complication. So actual over potential again. 8.6, University Hospital, using the information in the table below, calculate the complication rate for each service and then the total and round to 2 decimal places. And so we've got by service, I've got this first one written out for y'all. By service, and these are so wonderful. We're just pulling the information out of the table. They're so nice and neat. You know your homework is going to be a little more challenging, but at least we're starting off nice and simple in the book. So you're going to take your number of complications under medicine, 197, multiply by 100, over total number of discharges. And that's how I came up with 7.18%. You see the rest of the rates for the remaining services, and then for the total you had to add up the number of complications, you had to add up the discharges, and when you plug that in you're going to get 7.16%. So you can pause here and grab the rest of the answers.